So let us begin with today's Allen's keynote study streak. It is almost more than 35 days we are on this streak of studying every day. And let us consider two remedies today which are very similar, act on the similar organs. And let us start with chelidonium first. So chelidonium is indicated in conditions which are renewed by change of weather. This is what Allen mentions. There are other remedies which discussed so far in Allen's keynotes. One was thank you Dr. Sheetal for joining. So one of the remedies we know was Merck Sol. Other remedy we know for change of weather, extremes of weather, was Ipecac, very strongly mentioned. Another was Sepia. So in this way there are little things which extremes of weathers have been mentioned in different remedies at different areas. For Sepia, it is mentioned in one of the corners. It's just a change of season, not the change of weather which is mentioned, not the extremes of temperature. So there are little differences, but if you are able to pick it up from the weather changes from the patient, it will become easy. So that's what is there as a causative factor for chelidonium from Allen's keynotes. It acts on persons of light complexion, blonde, thin, spare, irritable, subject to hepatic and gastric and abdominal troubles. Also very close remedy we see mentioned is podophyllum. Every age, sex or temperament. So we saw in many remedies there was written that it acts on extremes of life, like in Etuza, like in borax, like in other remedies. We see that there is mentioned that there is extremes of life where the remedy acts. In fact, in opium also. But for chelidonium, it can work on children, it can work on infants firstly, toddlers, children. So that's what the constitution of chelidonium says in Allen's keynotes. Now the side affection which we see for chelidonium is mostly the right side. It can be right eye, right lung, right hypochondrium, and also abdomen, right hip and leg. So this is one of the key indications. You will have remedies which work from right to left, you will have remedies which work from left to right. And if you make a list of your remedies, in fact if you open Kent repertory, you will see that there are remedies mentioned for side of the body, left side, right side, and working on both the sides. If you are able to make that list based upon your understanding, your practice, and also referring the authors which I have mentioned, it becomes easier for you to prescribe in cases which have unilateral complaints. Like we saw in pulsatilla, there are unilateral complaints. One side will be cold, one side will be hot. Similarly, we have also in chelidonium, also we had in lycopodium. In chelidonium, what we see is right foot is cold as icy and left is natural. Now this is a kind of an observation symptom. You can pick it up when you are examining the patient. At times the patient may not be able to tell these things because they do not understand that these are valuable things, and maybe they will tell you that it seems more or less same. But when you check, when you examine, you will find that the feet is a bit icy cold right side, whereas the left was completely natural, which is also the case with lycopodium. If there is unilateral complaints, then you should think of pulsatilla. If there is one side hot, one side cold, you can think of chamomilla, you can think of chelidonium, you can think of lycopodium. All three remedies have ailments from vexation, ailments from chagrin on, and you can see that they are very snappish and very angry remedies. Although lyco will have a bit of cowardice in him, but all the other remedies that I mentioned, especially chamomilla, will have more of angriness, more of snappishness. Next we have one very peculiar symptom, and this should be your prescriptive pointer, and you shouldn't miss this. If the patient tells you that my complaints get better after dinner, after eating dinner there is no complaint, there is very less complaint, I feel much better, that is chelidonium for you. So in most of the cases you will get that Most of the liver complaint cases, gallbladder cases will have aggravation after eating, especially 1 hour after eating. So their gastroduodenal junction, is the seat of affection where after 1 hour the food reaches there, and biliary secretion is impeded or reduced or increased, and accordingly we can think of those remedies. If the patient is better by having meals at night, or he does not have any complaint, basically the complaints will only be after the lunch in the afternoon, then you can think of chelidonium. So very less times you will find this in the repertory as a key indication, but in the materia medica it's mentioned singularly over here right now. So you can rely on this very strongly, and this can become your prescriptive pointer rather than just keeping it aside for memorizing from the academic point of view. Next you have is appearance of the face. In chelidonium it is forehead, nose, cheeks, which are all yellowish in nature. So you know that there is a tinge of jaundice which is seen in the skin, and initial cases of jaundice or terminal stages of jaundice where the life is critical junction, you can think of chelidonium. You will need to base the prescription on the other factors also, which can come down the line, or you will need to study the different books also, because no one book is sufficient. Next you have is periodical orbital neuralgia, right sided and with excessive lacrimation. Tears fairly gush out, so very easily they will move to tears. They will have tears as a concomitant symptom with most of their complaints, and this is one of the chief indication. I have given it to many cases of jaundice based upon this indication of tears coming out easily, the eyes are watering easily, and this is something which you can pick it up very finely. Sometimes you feel that some symptoms patient is complaining just because he is hysterical, or just because he is allergic, or just because he is having this trivial symptom. But every trivial symptom will be your guide to prescription. So for chelidonium it will mostly be lacrimation which is excessive and flowing throughout the patient's complete chief complaint, and that should be your guide. So the next remedy which is mentioned in bracket is also rust ox. Next you have is tongue, and one of the chief indications of chelidonium should be the tongue, because tongue has imprint of teeth like we see in Merksol, like we see in podophyllum also. So in chelidonium it is tongue which is thickly coated, yellow with red edges and showing imprint of teeth, whereas in Merksol it is large and flabby tongue with imprint of teeth, and podophyllum will also have the reddish edges of the tongue. Next you have is pneumonia, especially of the right side with some liver complications, the other remedy being Merksol. Spasmodic cough, small lumps of mucus fly from the mouth when coughing. Very strong remedy we should think of is Coccus cacti and phosphorus also in such instances. But the other two remedies mentioned over here are Badiaga and Kalikab. So many times patients will tell you that I am not able to bring out the cough manually, but when the coughing happens, it kind of flies out from my mouth, or it lands somewhere outside in small flecks which have lot of tough mucus. In those cases, think of chelidonium, Badiaga, Kalikab, phosphorus, Coccus cacti also. In Coccus cacti, it will mostly be excess of coughing and expectoration, which he will manually be able to bring out. In chelidonium it will actually fly out. It is also there in phosphorus where it flies out kind of. And another remedy we should also think in such cases is Kali bichromicum, because it is one of the most frequently used and abused acute and subacute cases remedies. Next you have is gastrointestinal system, which have desire for very hot drinks unless almost boiling. Stomach will not retain them. arsenic and cascarilla are the other two remedies. Constipation stool is hard, round balls like sheep's dung. Opium, plumbum are the next two remedies. There is alternate constipation and diarrhea. Diarrhea, which happens at night, we saw this in sulfur. I spoke about strontium carb also. It's not there in the Allen Skinners, but it comes from boric materia medica to tell you about this remedy. And you have it in chelidonium as well. Diarrhea at night, slimy, light grey, bright yellow, brown, white, watery, pasty, involuntary. Hepatic diseases and jaundice with pain in the right shoulder, anything affecting the right shoulder with the liver complaint, think of chelidonium very strongly. Then you have gallstones with pain under the right shoulder blade, backside, and if there are frequent attacks of terrible gallstone pain, you should think of cardus marinus. But if there is pain which is constant, dull kind of pain which is regularly there under the right shoulder blade, think of chelidonium, especially in low potencies like 30 with frequent repetition. Okay, so next again we have the similar symptom mentioned the second time, which is constant pain under the lower and inner angle of the right scapula. Kalikab and Merck also have been mentioned. If it is under the left, it is sanguinaria and chenopodium, which is one of the remedies. Next we have is on the skin. There is yellow grey color of the skin, wilted skin of the palms of the hands, and other remedy being sepia. Next we have is old putrid ulcers which are spreading with a history of liver disease or of tubercular disease or tubercular diathesis. So if you see this tubercular diathesis is mentioned, we saw that in bromium, we saw that in belladonna, we saw that in different remedies mentioned scattered in different areas. For bromium it was initially, for tubercular, for belladonna tubercular was mentioned somewhere in between the explanations. So in this way, if you are able to collect all the different mentions of tubercular in different areas, your job of prescribing in such conditions where there was history of tuberculosis or they seem to be tubercular becomes very easy. So here it is mentioned that patients have tubercular diathesis, either any of his or her parents suffered from tubercular as a tuberculosis as a disease, or they look like tubercular appearing patients which are more restless, tendency to chest diseases, frequent attacks of chest diseases, and in those cases if they develop liver complaints, think of chelidonium. Next you have is chelidonium, which antidotes the abuse of bryonia, especially in hepatic complaints. We can compare chelidonium with aconite, bryonia, lyco, merksol, nux vomica, sanguinaria, sepia and sulfur. So next you have is one of the very vital things, and if you are a good student of materia medica, you will pick up these small things from different books and make your own notes. And I have suggested it off and on again and again to all the students that you make your own notes. You can rely on the books that are available, the materia medica that are available, but whatever you observe from different books, pick them up, write it down or note it down or register it somewhere in one separate place. For example, in sepia and sanguinaria we read that these two remedies are required to complete the cure of one another. In other remedies we read about complementary relationships, like in drosera we read about nux vomica. In hepar sulf we write that hepar will help in cases where entintat is indicated, or vice versa, entintat is indicated in hepar cases. So similarly for chelidonium, you see that there is arsenic, lyco and sulfur which will be required to complete the cure. If you are stuck up in cases where you have given chelidonium, cases have jaundice, cases have more complaints from gastric liver disease complaints, and you have given chelidonium, but the case proceeds towards cure, and at the final few areas it gets stuck up. It can be that patient is not improving further, there is some disturbance which the patient tells you again and again, and he is not getting better at it. Think of completing the cure with arsenic lycosulfur, or refer to Boni-Mosen concordances, or refer to Gibson and Miller's chart, which is mentioned at the back of Boric and Kent's repertory. So we complete this wonderful remedy, chelidonium, which we can give in wide range of conditions on the right side of the body. And next we go to a small remedy which is mentioned in the Allen's keynotes as a separate note, the remedy being cholestrinum. So we can read it and we find out that Swan appears to have taken this hint from Burnett, and he has potentized the remedy, and he used the potentization of some preparations of gallstones, and when he prepared it, he found it that it, if it is given to patients who have gallstone, it relieves the distress at once. So those who are treating gallstones, believe me, it's very difficult. It's not so easy like the ureteric calculi. Ureteric calculi, we see patients giving you the results in few hours to few days to few months. Gallstones may require months and years also. And if you need to really break the stone and get it out from the biliary duct through the discharges, think of cholestrinum, think of Cardus marianus, think of chelidonium based upon the indications. Only then you will succeed. Functional cases are very easy to treat by all class of homeopaths. If you are a good student of materia medica, if you are a good student of repertory, you will pick up something which is peculiar in the case, and you will be able to treat pathological cases, because our job does not limit us to just functional cases. So many doctors, so many homeopaths keep on posting before after in their clinic timelines on the social media. But if you see that allopaths are doing this in their clinics day in and day out, if you are able to cure pathological cases by picking up something which is very interesting in the patient, it's going to change your practice, your confidence, and the patient's trust will increase, and he will refer more patients. So cholestrinum can be thought in cases where there is gallbladder colic, frequent attacks of gallbladder colic. We read also in chelidonium for the remedy Cardus marianus, and you can see that it is mentioned that cholestrinum is almost a specific for gallstone colic. So think of gallstone colic, think of cholestrinum. You can also think of berberis and colocin for gallstone colic. After the failure of giving Nux vomica, China, Cardus, Porophyllum, and all well selected remedies, Swan decided that cholestrinum should be the first remedy you should think of in cases of gallbladder colic. Then you have an author named as Ingling, who mentioned that there were some diseases of the liver and gallstone colic which he cured with cholestrinum. So you have these authors who used to publish their works in medical books which were peer reviewed, which were read by renowned homeopaths, by renowned doctors who turned into homeopath after practicing allopathy. So you know that it's very much reliable. And going further in Allen's keynotes, we see that Clark has also mentioned that it is found, cholesterol is found in blood, in the brain, in the yolks of the eggs and seeds and buds of the plants, but it is most abundantly found in bile and biliary duct. And it is very fatty to touch, and it is found in it occurs in the form of crystals with a mother of pearl luster, which is actually what the appearance of these gallbladder stones also look like. And you can see that it is mentioned in Allen's keynotes that it is soluble in alcohol and ether. And then you have another author, Amerike, who has mentioned that cancer of liver was rapidly cured with cholestrinum, and there was obstinate engorgement and malignancy which was suspected, and cholestrinum helped cure that. Now coming to the main authority who has left, right and center cured a lot of pathological cases, more than anyone that we ever know from our stalwarts, and he is none other than Dr. Burnett. So he has claimed that he cured twice cancer of liver and hepatic engorgements, and when it was actually a case which was yielding very slowly to other well selected remedies, and if the diagnosis is confirmed, you will be able to give cholestrinum without any doubt. And then there are two cases mentioned by Ingling, which have the first case mentioned as attacks come suddenly and cease suddenly, which is what we see also in colosynth. Pain is pushing in the region of gall duct. Very commonly you will find this in all the gallbladder colic cases. In fact, at that moment when the patient is in pain, he may not be able to give you the modality, and at times they get enraged because too many questions by the homeopath will probably lead them to take a painkiller. Then there is marked acidity of the stomach since the last attack. So he will tell you that 2 days ago also I had the same gallbladder stone, and since then I am having lot of gastric distress, and today again the same type of pain has started. That will lead you to indicate to prescribe cholestrinum. And regions of liver sore, sensitive to touch or jar, aggravated lying on the sides. Second case what Ingling mentions is that the patient vomits bile, becomes very yellow, liver is sensitive, sore, pressure in front or behind, very painful, worse in the region of gall duct, and bending or sudden motion aggravates. Now if you go and read Berberis vulgaris, bending or sudden motion aggravates or worse in various attitudes is what is mentioned for Berberis vulgaris as a modality. In fact, in one of the repertories, and I spoke that in the lecture on Berberis as well, that in one of the repertories, Berberis is only remedy mentioned in the rubric where there is renal calculi and gallbladder calculi. So you can think of Berberis very strongly. But here we have cholestrinum, which is also having a similar modality. So probably you will give these remedies, the other polycrest and the bigger remedies, Berberis, colosynth, Cardus marianus, Nux vomica, and you will fail. In those cases, don't think of intercurrent, don't think of any other polycrest, but think of this remedy which is cholestrinum. And Ingling gave the cholestrinum 2M potency, which not only relieved the acute attack, but it also effected kind of a cure. So in this way we can see that how beautifully the remedy cholestrinum can be prescribed based upon the indications. However, this is a very small book to consider. You have many new books, new authors who have written a lot of data. Cholestrinum will also be found in some repertories. You can find out the rubrics, make it your own synopsis of the remedy, and make your own indications to prescribe, and probably you will have more chances of succeeding at gallbladder stone colic or gallbladder as a disease to be cured. Give results in pathological conditions and get the success you desire, you need, and also give the credit to homeopathy. Treating functional cases is pretty easy. Everyone does it. Allopathic doctors have treated typhoid, 10 to 15 typhoids a day or more they treat. But if we treat one typhoid, we get so excited that we are on the top of the world. Try to achieve a level where we can match them in terms of disease, in terms of treatment, by reading these smaller remedies, and probably we will at some day each of us reach that pinnacle where all the other allopathic practitioners are treating the diseases. So that's all from me right now from the Allen's Keynote Study Streak, and we meet again tomorrow 5:15 and we start with the next set of remedies. There are about 60-70 more remedies left, and we'll continue this till we finish the Allen's Keynotes Study Streak, Allen's Keynotes as a whole book, and we'll take up something else later on. But meanwhile, if anyone wish to join my upcoming workshop on fevers, how do you take the fever case, how do you what are the areas you need to focus on, whether it is prodrome, whether it is what is in chill, what is in heat, what is in sweat, what all details you need to pick up and implement, and what to do after when the fever is not there, what should be done, and what are the medicines. Probably we are stuck up with just two medicines, aconite, belladonna, arsenic, or something like that. But there are many remedies and many indications of the remedies. If you are not attending this, you are missing out on something, and you probably need to revise everything from different books. I have brought everything together from all the literatures, from my own experience, and will bring it out in the best of my expertise. So that's all for today, and see you all tomorrow.